Clostridium difficile infection, CDI, is a bacterial infection that affects the colon or large intestine, causing symptoms such as diarrhea, abdominal pain, fever, and dehydration. Clostridium difficile, also known as C. difficile or C. diff, is a type of bacteria that is normally present in the gut of some individuals without causing harm. However, certain factors such as antibiotic use or a weakened immune system can disrupt the natural balance of gut bacteria and allow C. difficile to grow and release toxins that damage the colon, leading to inflammation and diarrhea. CDI is most common in older adults in hospitals or long-term care facilities, where antibiotic use is common and the risk of infection is higher. However, the infection can also occur in people who have not been hospitalized, and outbreaks have been reported in community settings. CDI can range from mild to severe, and in some cases, it can be life-threatening, especially if the patient is older or has underlying health conditions. Diagnosis of CDI is usually based on laboratory tests that detect the presence of C. difficile toxins in a stool sample. Treatment typically involves antibiotics, such as metronidazole, vancomycin, or fidaxomicin, and other supportive measures to manage symptoms and prevent complications. In some cases, fecal microbiota transplantation, FMT, may be used to treat recurrent CDI. Prevention measures include appropriate use of antibiotics, good hand hygiene, and infection control practices in healthcare settings. The treatment options for Clostridium difficile diarrhea. Antibiotic therapy. The primary treatment for Clostridium difficile infection is antibiotic therapy, which is intended to kill the bacteria causing the infection. The antibiotics most commonly used are metronidazole, vancomycin, and fidaxomicin. The choice of antibiotic may depend on the severity of the infection, previous response to antibiotics, and other factors. Treatment usually lasts for 10 to 14 days, but may be extended for up to 21 days in severe cases. Probiotics. Probiotics are live bacteria and yeasts that are beneficial to health, and may help restore the balance of bacteria in the gut. Some studies have suggested that taking probiotics can reduce the risk of recurrent Clostridium difficile infections. However, the evidence is mixed and further research is needed. Commonly used probiotics for this purpose include Lactobacillus and Saccharomyces. Fecal microbiota transplantation, FMT. FMT is a procedure in which stool from a healthy donor is transplanted into the colon of the patient. The goal is to restore the natural balance of gut bacteria and eliminate Clostridium difficile infection. FMT has been shown to be highly effective in treating recurrent Clostridium difficile infections, with cure rates of up to 90%. The procedure is typically performed via colonoscopy, nasogastric tube, or enema. Surgery. In rare cases, surgery may be necessary to remove part of the colon if the infection is severe and does not respond to other treatments. This may be necessary in patients who develop complications such as toxic megacolon, bowel perforation, or sepsis. Fluid replacement. Patients with Clostridium difficile infection may experience dehydration due to diarrhea, so it is important to replace fluids and electrolytes to maintain hydration and prevent complications. Oral rehydration solutions, intravenous fluids, and electrolyte replacement may be used to achieve this. It is important to note that the exact course of treatment for Clostridium difficile infection will depend on the severity of the infection, the patient's overall health, and other individual factors. Treatment should be individualized and guided by a healthcare provider with experience in managing this condition.